KPN is a multivitamin product that is used to treat or prevent vitamin deficiency. This can happen due to a poor diet, certain illnesses, or during pregnancy. Vitamins are important for the body and help to keep you in good health. When taking KPN, it is important to follow the instructions given by your doctor or as directed on the product package. Typically, KPN is taken by mouth once daily. It is important not to exceed the recommended dosage. If you have any questions about the medication, it is best to consult with your doctor or pharmacist. In order to get the most benefit from KPN, it should be taken regularly at the same time each day. This will help you remember to take it and maximize its effectiveness. If you experience constipation, diarrhea, or upset stomach, these effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, tell your doctor or pharmacist right away. Your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. A severe allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed here, contact your doctor or pharmacist. For medical advice about side effects in the U.S., call your doctor or report to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, call your doctor or report to Health Canada at 1-866-234-2345. If your multivitamin contains iron, it's important to keep it away from children as accidental overdose of iron can be fatal for children under 6 years old. If overdose occurs, seek medical help immediately or call a poison control center. Before taking KPN, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any history of alcohol use, liver problems, or stomach/intestinal issues. If your multivitamin contains folic acid, be sure to mention if you have a vitamin B12 deficiency before taking it, as folic acid can affect certain lab tests for this deficiency. It's also important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, especially before having surgery. If you are pregnant or breastfeeding, be sure to consult your doctor before using KPN. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not change the dosage or stop any medicines without your doctor's approval. If your multivitamin contains iron, you should avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your doctor or pharmacist about the best timing for taking these medications. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you are taking certain anti-seizure drugs. This medication may also interfere with certain lab tests, so it's important to let lab personnel and your doctors know that you are taking this drug. If someone has taken too much KPN and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember to keep all of your medical and lab appointments while taking KPN. Some brands may also contain ingredients such as docusate, so it's important to ask your doctor or pharmacist if you have any questions about the ingredients in your specific brand. It's important to note that KPN is not a substitute for a proper diet. It's best to get your vitamins from healthy foods and maintain a well-balanced diet. Be sure to follow any dietary guidelines as directed by your doctor. And remember, always consult your doctor before making any changes to your medication or diet. If you are taking KPN on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. It is important to store KPN at room temperature, away from light and moisture. Do not store it in the bathroom, and be sure to keep all medications away from children and pets. When it comes time to get rid of any unused KPN, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, be sure to properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.